Hi folks, if you are someone that suffers from pectus carinatum, where the sternum protrudes outward or the chest protrudes outward like this and a point in the sternum area. Well, this is a chest wall deformity, and the sternum and rib cartilage, as I said, grows outward, but often it becomes noticeable during your adolescent years, during your growth spurts. If you're someone that suffers from this, you're one in maybe 1,000 to 1,500 people that deal with some sort of pectus carinatum. And again, that's when the rib cage or the sternum protrudes outward. It's the opposite of pectus incavatum or excavatum. Okay. Now, pectus carinatum affects males more than females at a ratio of about 4 to 7. And it's mostly a cosmetic issue, but some people with this condition can experience some physical symptoms like chest pain. Costochondritis is one of them, and that's a condition I specialize in. So if you have pectus incavatum, excavatum, or in this case, what this video is about, pectus carinatum, then this could make you more susceptible to a case of costochondritis, or even just back pain, or discomfort during exercise or lying face down. Those things can aggravate you. And some people do get asthma-like symptoms, shortness of breath. And then there's some other rare associations to pectus carinatum. And some of those other conditions that are associated with it are more rare, but scoliosis, and then, of course, some connective tissue diseases like Marfan syndrome, rib or cardiac valve issues that come along with them. Yes, there are surgeries, but not really recommended for this condition. Something you can typically diagnose just from a physical exam, but in some cases, X-ray or CT or MRI imaging might be needed, but typically you can see it on a physical exam. But the non-surgical approaches, bracing, chiropractic, physical therapy to help with some of the pain, and for really severe cases, when bracing fails, surgical procedures. And that's a specific technique called the Ravitch technique, or reverse Nuss correct chest wall alignment. And those are really, really invasive procedures. I highly recommend doing everything to avoid them. Cold laser therapy with chiropractic can also be helpful. I hope this helps those of you that are suffering from pectus carinatum and maybe have costochondritis. And if you have both, chiropractic with cold laser therapy can be really helpful for pectus carinatum with costochondritis. Thanks for tuning in. And if you got anything from this video, I appreciate the thumbs up, and feel free to subscribe. We pump out 4 videos every week. Thanks for tuning in again.